That is on iTunes.
I think so. I think that's the one he does. Yeah.
Can you go silent?
So yeah. So what you want to do is you want to be able to identify many of the vessels that we just went over with the heart and with the descending aorta and inferior vena cava. But here we can see some of their branches. We can again see the aorta and the branches coming off the aorta. We can see actually it's a little bit better because we can see from the posterior view, actually it's much easier. Now remember, if you're looking at the posterior view, make sure you can determine right from left. Remember that you're looking at the back, so the right is going to be on this side and left is going to be on this side. Okay, so we can see coming off our aorta, we have the brachiocephalic artery. It goes into the common carotid artery and the right subclavian artery. Our second branching off the aorta is the left common carotid artery, and then here we can see our left subclavian artery, and we can actually follow it down. It goes under the clavicle, and then it goes under the armpit as the axillary artery. It becomes the brachial artery, and then it branches in the cubital region, okay, the inside of your elbow, into the radial and ulnar arteries, okay? So our thumb should be like this. Our thumb area, let me just make sure this is correct. 2. Okay, so our thumb should be here, so this should be the radial artery, and this would be the ulnar artery. Again, we can see these better when we have other bones or muscles that we can use as a way to orient ourselves. The venous return mimics the actual arteries. We can see that returning from the head and neck area, we have not a carotid vein, but a jugular vein, and it will join the right and left brachiocephalic veins to the superior vena cava. The subclavian veins follow the subclavian arteries on the right and left side. When we get to the venous system in the arm, of course we have our vascular arm model, but we can see here our brachial or basilic vein. We have a cephalic vein as well going into the subclavian vein. Here in the cubital region, we look for the vein that crosses diagonally across the inside of the elbow, and that's your median cubital vein, this one right here. And then, of course, going down towards the thumb is going to be the radial vein, and towards the pinky is the ulnar vein. Okay. We can also see the common carotid arteries as they extend into the head. And again, we do have a head model to look at this more closely. We could see the left common carotid artery goes up, and then it branches into an internal carotid and an external carotid. You can see the external carotid feeds the outside of the face. The internal carotid enters into the cranium, and it actually makes up the middle branches, or the sides of the circle of Willis. Can you see that circle right there? The posterior wall of the circle of Willis is formed by this thick creature with the many, many branches on either side, and that is your basilar artery. And we could see that there are 2 arteries that come up and form the basilar artery, and these are the right and left vertebral arteries. Again, we could see these much better on our head model, and this is actually much better. Okay. Now, if we look at our descending aorta, the thoracic aorta, we have lots of branches that feed our intercostal muscles, but we really want to look at the abdominal aorta. We can see in the posterior view the renal arteries going to the kidneys, and we can see the divisions of the abdominal aorta into the common iliac arteries, the internal and external iliac arteries. But if we go around to the anterior of the model, we start seeing some of the branches coming off. Again, it's hard to tell because the branches aren't actually you can't see the organs they're going to, with the exception of the splenic artery. We have our first branching of the abdominal aorta, and that's the celiac trunk, way up here underneath the liver. We can see it extends for just a short little period, and then it branches into a gastric artery right here, which circles around the stomach, a splenic artery, which goes over to the spleen, and then there's a hepatic artery. You can see one of the branches goes up into the liver. There are accompanying veins with the venous return. We have our splenic vein returning to our portal system. We have our gastric vein here, and we'll talk about the liver, hepatic, and the hepatic portal vein afterwards. We can see another branching just underneath that. This is it right here, this very long piece. It has a number 93 on it, I believe. This is your superior mesenteric artery, and it runs along with the superior mesenteric vein going to the small intestine. The next branching underneath that are the renal arteries, and we can see our renal veins going along with it. Beneath that, we have our gonadal. They've actually kind of really, really thin little spiky arteries coming off, and one vein coming off the